Welcome to Dentists in the Know. Welcome to Humpday Happy Hour, hosted by Dentists in the Know, I should say. The show where dentistry meets real talk, real news, and just the right amount of sarcasm. We're pulling back the curtain on the industry, talking to the experts, the innovators, and the everyday clinicians, the ones that are out there doing the work. There's no fluff, there's no filter, and definitely no sales pitches disguised as education. If it's happening in dentistry, from clinical insights to regulatory curveballs or the latest scandal at the ADA, we're probably already talking about it. And yes, we are bringing the goods. So whether you're a seasoned doc, in the dental industry, part of a dental team, or just here for the drama, welcome to the show. And I do promise you there's going to be some drama, because around here, we are not just in the loop. We are in the know. So welcome, everybody, to Humpday Happy Hour with Dentists in the Know. I'm joined by two of my best friends in the industry, Dr. Chad Duplantis and Dr. Jennifer Bell. So welcome, guys. Good to see you. We had an off week last week, and obviously for good reasons. Our thoughts and prayers go out to the Kirk family, and we hope that everyone is in maybe better spirits this evening. And I'm excited to be here. We have a great guest. The show is sponsored by iTero, and we are just so excited to get started. So how's your week been, guys?
Chad?
It's been great. It's been really great.
Wait, where is the energy? We just had this really high energy pre-show.
I just wanted to do that because
I thought we were going to be on fire.
Everything.
You know who it reminds me of? Rick Moranis. Did you ever see that movie?
Oh my gosh. You know what, though? If you go to that movie,
I'm a certified public accountant, and definitely think that if you had saved on your individual taxes, that you'd be much better off today.
Hey, do you remember Parenthood, when Rick Moranis and Steve Martin were sitting around the table and they had that like bingo card, and Rick Moranis' daughter was calling out all the numbers and Steve Martin's kid was eating the numbers as she was calling them off? My kid is the one that eats the numbers.
Yeah, I believe that.
That's my name.
Austin,
I love
right?
it dearly.
Obviously.
Yeah.
Oh, Austin would be the one counting the numbers. Ava would be the one eating the numbers.
Eat the numbers.
Yeah.
She's pretty, yeah.
I do have to say, look at the gene pool there. Just
hey
saying.
now.
Yeah.
Hey now. Yeah. I'm telling you, they got it all from Ellen's side.
How's your week, Jeff? Is it getting better?
Is what getting better?
Your life?
My life blows. I mean, what am I going to say? Yeah, I am about to commit suicide, and everyone knows that's not true. By the way,
not true.
I'm putting this out there for the world, and everyone that knows me well enough knows that I am so freaking afraid to die that if there is ever the words Jeff Horowitz and suicide next to each other, there is no freaking way that's true.
Right. Start the investigation immediately.
The dude is too afraid to die to commit suicide.
Right.
Just putting that out there for the whole world to hear. Hopefully this goes across the universe. And
I feel like you're concerned about your search history on your computer.
Yeah.
Like a little bit.
No problem.
It may come back and bite you. I don't know.
Do you have Discord chats, Jeff? Or
do you have a Silk Road account?
No, nothing.
No? All right.
Got rid of my mind.
Last year. We'll see about that.
Yeah. OnlyFans gone. Not doing
Finders? No?
Yeah. Well.
Okay, carry on.
Listen, we all have to have some kind of a vice, right? Things are very good, and I am very happy, and I hope you two are too.
How was Texas?
Yeah.
Good?
Texas was amazing. The Academy of General Dentistry in Texas, their constituent, is just amazing. We always said that. We had some great friends from Texas, very active in the AGD, always were leaders. on the legislative side and the House of Delegates, and certainly in education too. So to our good friend Tanya Sue and Carrie, what a great program they put on.
I didn't know he had props.
Yeah, I just want to let you know we appreciate you coming to Texas, Jeff.
I have a can of air. I don't have a
yeah.
It just happened. A hat.
I have a bottle of wine.
Okay.
Yeah.
Yeah.
Well, okay. I'll think about props for next week.
Okay. Well, JB, how was your week?
It's been fine. This has been a really hectic season. I was talking to Sarah about that before we got on, who's our guest tonight. I had been watching it on my calendar for 3 months, knowing September was going to be wild and lots of travel, and it has lived right up to exactly what I thought it was going to be. So this weekend, tomorrow, is my last travel date, at least for a few weeks. So I'm really looking forward to capstoning that and being done. I'll be in New York doing a really fun hands-on course with some docs up there. So that'll be a good time. But yeah, because it's such a hectic time. The kids are back in school. Lots going on. So it's an hour by hour operation here in Holly Springs right now.
It always is. I mean, come on. You got 3 kids running around the house.
Yeah.
You're doing a show. You got 2 offices. I'm saying it's always minute to minute, and you can't tell me otherwise.
Yeah, you're right. You're right. When I get a lunch packed the night before, I'm living large.
That's
living large.
Hashtag winning. We did. Oh, I have to say, did you watch the Charlie Sheen documentary yet?
No, but I heard about it from a patient today. I think I have to watch it.
Nothing to do with dentistry. Just Jenny and I sat and watched that, and it was like, okay.
Yeah, I've heard I can't watch it with any kids around.
I can't do it.
Yeah.
Oh, you're an anti-sheener.
No, I'm not an anti-sheener, but I rode in a arranged car service in Green Bay, Wisconsin, and the week before Charlie Sheen had been in that car, and I found out what he had done in that car, and I don't know that I want to watch his documentary anymore.
Well, you'll learn a lot about what he's done.
Maybe you'll see that car in the documentary.
Yeah, I don't know. There were some wild stories that came out of that car.
Yeah. Well, I'm not going to give it away other than saying he does talk about what's on the other side of the menu. Just going to leave it at that.
Yeah.
Gotcha. Yeah, I'm out. I'm good. I'll go watch the documentary on his brother, Emilio Estevez. I'm good.
Hey, what a normal guy. Emilio is completely normal. He's in.
As far as we know.
Yeah.
As far as we know.
Well, comparatively. So, anyway, I think we should let JB do some news.
I would love to.
I think so too.
Let's do it.
Okay.
All right,
well, we're going to stay away from national news today. It's been kind of a busy couple of weeks, actually, maybe 3 weeks all in. Lots going on. So we'll just sort of leave it at that. But there are a few things that are happening in the dental world as well that I think are absolutely worth mentioning. The first story might be one of my favorite stories that I've seen in a long time. There's a dentist suing a patient over a bad review. I love this. I think so many dentists would feel so vindicated if they could go after a patient who leaves maybe a stretched version of the truth of what happened in the office. So there's a Minnesota doctor who has now filed charges against a patient who is leaving negative reviews for his practice. The patient came into his clinic, had a couple things done, fillings, crowns. Outcome wasn't what I believe she was hoping for, had some issues, went to another doctor who said some of the work needed to be redone. Okay, fine. This story has played out 1,000 times before. But then the doctor's office, according to the court documents, had offered to have her come back in to see if they could help. They've even offered her financial payment for the services that she had rendered, reimbursing back her insurance company as well. She wanted to increase that amount. When that wasn't met, and these are all the court documents, when that wasn't met, she then went forward with some additional negative reviews and then kept editing the negative reviews when the doctor filed legal charges against her. So I'm just saying, it's actually nice to see for the first time, maybe, that at least I'm aware of, that a doctor is standing up to the review system and saying, look, we get it. If you want to voice your opinion about whether or not you like the fact that we take x-rays, totally fine to go on Google and Yelp and let people know about that. But when you use those platforms to spread misinformation, incorrect information, or to just defame somebody who's running a small business, just trying to, bring home money to take care of his wife and kids, then enough already. Like, your point is a little bit done. And now we're going to see it play out in court. I think it's really important that will then set a precedent. Fingers crossed that this will go in the favor of the dentist, just because I think we need it to be able to set some type of standard for how dentists and patients can interact with one another through the review system. We're really have been told for a long time to keep it tight, not respond because of HIPAA violations. And there have been a couple of doctors who've been cited for HIPAA violations in the past for at least acknowledging that patient was a patient of their practice. So it'll be nice to start getting some type of, benchmark or metric that we can operate by and how we manage these reviews moving forward. Because frankly, it's getting a little old for dentists to be held somehow hostage to the court of public opinion. The next interesting story that came out is we talked about this about a year ago. There was a lot of activity in the FTC about non-compete, and they were going to go after the non-compete stance. They were going to, change the language on the non-competes and actually kind of open up non-competitive language. Well, the FTC has now said it will not fight a lower court's decision to throw out that rule. The FTC voted 3-1 on that on September 5th to dismiss the appeals in the lower court. So I guess we're going to see that kind of fade off into the sunset again. We'll see if it rises back up to the top at some point. We do believe that it opens up the door for additional conversation about non-compete, and certainly state by state, some states are going to enforce it a lot tighter than others. So just know your language well. But if you've been operating under that old piece of news that we ran with a year ago about FTC not really recognizing non-compete agreements anymore, that is factually not true. Your non-compete will stand if you have signed one. So make sure you know the language really well, and ultimately how your state is siding for or against those non-competes. And with that, that's the news.
I was hearing a little bit of Eminem, but it was FCC in the song and not FTC. So, I was going to come in here and go, the FTC won't let me be, but it really didn't work to what you were talking about.
It's not really working now, actually.
Not relevant.
Not that. No.
Yeah, I kind of figured that.
You did better with OPP, and I can't remember how you used it, but that one went pretty well. Yeah. I thought that one executed.
OPP went well, but I just did get a little bit of Eminem in my head, and I got a little excited. So, but you know what I'm going to do? I'm going to let it
leave it there.
I'm just going to let it go. Yeah, I'm going to let it go.
Okay.
Here we go again.
Okay.
I think it is time for us to probably introduce our guest, who has watched this nonsense go on for entirely too long at this point.
Way too long.
Yeah. Align has graciously sponsored this show for us, and we have an amazing guest, and I think, JB, you're going to introduce her.
It's kind of my honor. Will you bring her up? Because, I'm blonde. I can't do two things at one time.
Yes.
I might even have gum in my mouth. I'm not 100% sure.
I can do that. Oh, she's already up.
Okay. Guys, have you ever, first off, when I fly on a plane, I'm really bad. I put my AirPods in and I'm non-communicado. Like, I don't really acknowledge the person next to me. I have my little snack. I do my work, whatever. Do you guys, Jeff, you're a chit chatter.
I am, but usually not on the plane is my best work time.
Correct.
It's honestly the only time that I have pure, quiet, nobody tapping me on the shoulder usually. So in that circumstance, I am more like you.
Okay. Well, God knew exactly what he was doing the day that he put me right beside Sarah. So I had met her briefly. We really didn't have much interaction. It was a little awkward, actually, because no one really formally introduced us. We were speaking at the same event, And there were only 4 people, and somehow, or like she was auditing the event because she was joining our faculty group for CDI for Align. So she was auditing, but the 4 of us were all speaking, but nobody actually formally introduced her and who she was. She was kind of a clingerer, like a lingerer around her. And I was like, who is this girl? Why is she? We should know her. Why is she hanging out? And also, has anybody seen this girl, Sarah? Because supposedly she's also here. And then eventually I figured out that the same person was Sarah.
We got a stage 3 clinger.
Correct.
Yeah.
But that was kind of it. I thought she seemed really nice. Great. I'm sure I'll see her around. But then I get on the plane. We're both flying home to, I'm flying to Atlanta because everybody to get to Raleigh has to go through Atlanta. She's flying home. And we sat beside each other. And to date, I haven't had a faster flight from one destination to the next, because for the next, I don't know, couple of hours, we talked nonstop. And when you meet somebody who is incredibly like-minded in the way that they practice dentistry and how they see the world, I think the 3 of us have all experienced, you see dentistry and you see patients in one way, and then you get super frustrated when people don't share that same common belief or common goal. So when you meet doctors who are like, oh yeah, and how about this thing with pediatric sleep management? We could be doing these things. We could be intervening with these kids really early and really helping them out. And her eyes are lighting up and my eyes are lighting up. And I could read her bio. We're going to put it on the YouTube links. You definitely should know more about her. But what I think really speaks to, number 1, why she's on the show tonight. Number 2, why she's become a dear friend of mine is that, number 1, she's incredibly easy to talk to, and she's an open book about her journey, which I hope she'll share with us tonight. Number 2, she's incredibly passionate about the type of doctor she has become. And she's also incredibly uplifting to the doctors around her to get them to come along by side. She's not like, oh, I'm the master, I'll keep the key. You guys can just watch me in awe. She's like, heck no, come on, you be a part of it, be a part of this evolution of what we should be doing in pediatric medicine and pediatric dentistry. And 3, she's like a really cool, awesome person. She surfs, which I think to date might be one of the few surfers we've actually had on the program. I don't know. Now I feel like I have to go back and survey a few folks, but I think I can speak that she might be the only surfer we've had. And I just think is doing life in a really cool way. So without further ado, my dear friend, Sarah Johnson, welcome to the show.
Thank you. That was like the best introduction.
I'll be your hype girl. I don't mind.
I almost forgot about that whole flight home.
And now the show's over.
Yeah.
Yeah, I wasted so much time on the intro.
That really didn't mean the world to me. But the funny thing is, Jen, like, you hit me in the same way. I'm the same way on the plane. Like, I want my earphones in. I don't want anybody bothering me. I sit down and I do my work. Like, I don't want to talk to anybody on the plane. I talk all day. Like, leave me alone. And like you said, the fastest flight ever. I got home and I was texting my boyfriend. I'm like, you will never believe what happened. I met this incredible doctor. I'm so in love with her. She's so awesome. And I think we're going to be great friends. And like,
I know my husband was blowing me up going, are you alive? I haven't heard from you in like 4 hours. I'm like, oh no, I'm fine. I have a friend. It's fine. I'm like a puppy. I'm going to follow her home now. It's good. I'll be home on Tuesday.
You could have.
Well, love the freaking, are we going to talk about anything tonight, or are we just make each other's egos?
You know why they're sad? Because I don't have that kind of kismet story with either of them.
Welcome to Love on StreamYard.
Okay, Sarah, please, for these 2 pool bags, can you please tell us your journey? Because I think your story of dentistry and how life is sort of interwoven in that a little bit is really important for both of them to know, but also for our listeners.
Yeah. So I'm going to try to condense it because it's a big one.
Yeah.
But my dad's a dentist. I mean, like, I am one of those generational dentists that when I was younger, so my dad grew up in Boston in the projects, and he was told he had ADHD, some learning disabilities, and was told he could never accomplish anything with his life. So what he did was prove them wrong, right? He felt that the way to make me succeed in life was to tell me the same thing. Like, you will never be good enough. You will never succeed. You can never be a dentist. You're not smart enough. You will never, when I did get into dental school, you're never going to own your own practice. You're not good enough. I worked for him for 2 years and it was chaos, like mental health down the toilet. I never thought I could become anything. I was always like, I wanted to prove him wrong, but I don't think that was the right motivation to get me to where I needed to be. It was just proving him wrong and making my dad proud. It wasn't for me. Move forward, I worked with my dad right when I got out of school, and then ended up moving to Arizona to kind of get away from that. And ended up in Arizona. I was fresh out of school. Like, if you're going to work in a private practice, you've got to know how to do third molar extractions. You got to know how to do endo. You got to do all implants, all these things that I did not know yet. So I joined a DSO. Stuck with the DSO for a long time. That kind of, on the one that I was in, I won't say all of them, but the one that I was in kind of exacerbated those feelings that I was never enough, that I couldn't accomplish enough. So it was just this constant battle. Well, 2020 hit, and we all know what 2020, like what happened at 2020. I had left the DSO in 2018, hopped to be an associate in a practice. 2020 happened, and I was one of the casualties of 2020, where my marriage ended up in a divorce. It was not something that I was wanting. It was not something I expected, but it happened. So I was faced with the reality of being a single mom. I had zero idea who I was as a person. I didn't know what made me me, what made me happy. I had always lived my life for somebody else, whether it be my dad, my spouse, my child. It was, my identity was wrapped up in those things. So 2020 happened, got divorced, and I was like, I don't know what to do with my life. But if I'm going to fail, like, I'm already failing. If I'm going to mess my life up, I might as well do it now. I'm going to buy a practice. But in the meantime, I had this really great friend, Stephanie Sweeney, who is actually the co-founder of our course that we're putting on. But she sat down with me. She brought me surfing to kind of redefine myself, step outside of your comfort box. And so we went surfing, and we sat down, and she made me read this book, The 4 Agreements. And we sat down and had a big conversation. She's like, why don't you own your own practice? And I'm like, I can't own. I don't know what I'm doing. Dental school never taught me this. Like, I'm not going to be able to do this. And one of the things that I always remember that she said to me was that you don't have to know everything that you're doing. You never will know everything. You just have to surround yourself with people that do. And so I jumped for it. I was like, what do I have to lose? If I'm going to fail, I'm going to do it. So I bought my dental practice in 2021, and it was like producing $680,000 a year. I had ultimately also gotten into airway dentistry, started dabbling in it because my son had some major issues that came to light, and started 2021, joined Align because I knew that I was dabbling in this airway stuff and I needed to know how to align teeth after I had expanded them. Joined Molis Coaching, got an iTero, which I swore I would never do. I swore I would never touch that machine. I was like, iTero is the devil. Like, I can use my CERT machine. I don't need to do that. Why can't I use any other scanner? Got the iTero. My practice grew 70% in the first year. I thought that I had a 5-year goal of not doing general dentistry anymore. And within 6 months, I had an associate on board doing all the general dentistry for me. And all I do now is airway and Invisalign. Got an almost $2 million practice in a 4-op practice, and life is thriving. I get to work 2 days a week now. I get to lecture. I get to spend time with my son. I enjoy dentistry again. I think I was very burnt out. Like, why am I doing this? Like, I'm drilling and filling, and patients hate me and complain about everything. Like, I gained back my joy for dentistry. I gained back that passion that I had because I was making a difference in people's lives. But I also found out who I was as a person in the meantime. And I've become a better mom, a better partner, a better friend. Like, my whole life in general has just changed dramatically since that journey. So yeah, that was supposed to be short. That was
That was great.
That was short.
That was, yeah, take as much time as you need.
Yeah.
That was fantastic.
All right. So let's talk airway. Let's talk about your son.
Yeah.
Jeff, let's get involved here.
What is this airway thing all about? Because I'm hearing so much talk about it.
Oh,
now.
Jeff,
something I think I'd like to get involved with.
Really, maybe I should also open a practice that only does TMD and sleep and airway.
I don't know how you do the TMD part. That's oof.
Yeah. First of all, kudos to you for really finding a passion in dentistry and saying, you know what, if I'm going to do this, I'm going to do the stuff that I love. And I think that translates to the patients. And so the fact that you were able to get into a practice and know what it was that you wanted to do and do well, kudos to you for that. I love it. And there's so many people out there when we talk about Airway that say, oh, I don't want to fool with medical insurance, or I don't want to fool with appliances or things like that. And it's really one of those things that, yes, it's a different kind of practice, and certainly you have to learn the clerical side certainly a little bit differently, but I think it's so rewarding. So what were your biggest what were the biggest hurdles for you when you decided to get into Airway? I'm curious because I know what I hear from people all the time. I'm curious what your biggest hurdles were, because obviously you were very successful at this. So what were those hurdles for you, and how have you overcome them?
Well, the first biggest hurdle was CE. I didn't know where to start. It was like, where you get thrown with all these, somebody has to look just like me. My big voice.
Maybe can you stop barking, please?
That was me. I was doing it. I can actually, like Idina Menzel, I let it go. I can actually bark out of my throat without you guys hearing.
Yeah.
Sorry.
But yeah, the CE was the hardest thing. I didn't know where to start. And you can delve into these classes that are like information overload. You're drinking from a water hose and you're like, this is too much for me. Like, this makes me not want to do this. And then you can delve into classes that are almost too basic, or they want to teach this appliance or that. And you're like, where do I go? And you spend thousands of dollars on trying to find that right fit for you. And I think for me, the hardest thing to understand was that it was a journey. I definitely chose some appliances in the beginning that just did not work, and that was hard and frustrating to handle. The billing, like you said, oh my goodness. I didn't know anything about ortho billing, any of that stuff. We don't do the medical portion because we really just treat for expansion in our office. So you have a beast unlike anything else. Like, but even just figuring out the ortho billing and understanding it, because we're in network. We're starting to drop. We just dropped Delta Dental. Yeah. But it was I felt in the beginning, because this was 10 years ago that I started entering this journey, there wasn't as much out there as there is now, which is phenomenal. Like, I can't tell you how much it excites me to hear, like, the American Academy of Pediatric Dentistry recognizing Airway and screening for Airway. Like, parents are educating themselves on Instagram and TikTok, and they're coming in and they're passionate and excited. Like, it used to be the conversation where I brought it up with the parents, and they would look at me like a deer in headlights and just be like, this is overwhelming. I need to process this, or we're just going to go to our orthodontist. We only care about straight teeth. We've never heard of this. Now the information's out there for the world to see, and it's become so much. I mean, I don't market for this. It just comes in now because parents are finding it and coming to me. So there were a lot different hurdles now, I mean, in the past, than I think doctors will have now coming into Airway, for sure.
Let me ask you one more thing, and it'll be very easy for me to just want to take over this conversation, just because obviously this is a big passion. But what, if you don't mind, I would love for you to talk about what you saw in your own child and what some of the fixes were that you were able to find, and how that's translated into what you're now doing in practice.
Absolutely. So my son, when he was born, had reflux that it was like, what's that movie? The Exorcist? Yeah, The Exorcist, where she sits up and it's like across the room. That was my son. And it was constant. Colic. He had chapped, like a big, huge bubble on his lip. He would sit there and stop breathing at night even. Like, I didn't get sleep when he was first born because I had him by my bed watching him. Then I didn't have that little thing that you could monitor their SO2 and stuff. I don't even know if I had it then, but constant issues. And I went to my pediatrician and I said, something is wrong. I don't understand what's going wrong. They sent me to a gastroenterologist, and the gastro said, oh, that's normal. I'm like, this is not normal. So little old me decided to start Googling everything. I was the one thing we tell our patients not to do, I did. And found out that it could be a lip and a tongue tie, and all the signs, all the symptoms. And the GI specialist told me I was an idiot, like legit told me I was an idiot. The pediatrician told me not to listen to that nonsense. I had the lactation consultant tell me, no, I don't see anything. Well, sure enough, he did. He had a lip and a tongue tie. We got it fixed, but it was too late. It was about 12 weeks out when we finally found a provider in Arizona that would do it for us, but she was brand new. I couldn't breastfeed anymore, so that was out of the game. He could finally take a bottle, but then don't get me started on the rest of that story, because that's a story in and of itself. But that started my journey. So I started learning about lip and tongue ties because I'm like, I do not want another parent to go through what I just went through. We were in and out of the hospital for months, failure to thrive, all of the stuff. When I started learning about lips and tongue ties, and then I went to, I think it was a Hinman, and I heard a doctor speak on the symptoms that can occur from improper development from tongues. And I was like, that's my kid. Hyperactivity, ADHD, bedwetting, like snoring, and I'm going, oh, my brain blew. And that's when I was like, I'm in. Game in. I don't care what it takes. I'm going to take every CE course possible to be able to start diagnosing this stuff, because so many kids, especially, are diagnosed with ADHD. And I might be a little bit of a crunchy mommy. No offense to anybody that puts their child on medication, but I personally was like, I don't want to do it. So what can I do? It was amazing to me to read the research on the link between ADHD and airway. And watching these kids transform in front of your face, where they're sleeping better, they're feeling better, they're getting off of their anxiety and medication, they're getting off depression medication. You can't get any bigger reward than seeing that, I went on a diatribe there. Sorry, I don't shut up sometimes.
No, but I think that's the powerful message here is, everybody has a real story. And this is why I think that this resonates so much with parents, and why you're hearing so much about it is you are not alone. Like there's a million of you out there running around that are looking for answers for their children.
Mm-hmm.
And so the fact that you took that a step further and said, not only do I want to help my child, I want to help other children that are out there. So what other than the tongue tie, what are some of the other protocols that you're using when you're assessing children?
There's a bunch. So we have a sheet that we give to parents to do kind of but child assessment. Butt up sleeping, reflux, ADHD, hyperactivity, disability, speech issues. So speech issues can be part of it with the tongue, snoring, stopping breathing. So we have that form where parents just kind of assess their child, and we encourage them to do it before they come in so that they can see and monitor these things. I treat adults too, but I don't treat them as much as I treat kids. Kids is my forte. I'm just now getting into the MARPE and learning that journey. But with kids, and then the other assessments we do are the tongue, the palate, so huge. A narrow palate and a high palate can cause so much obstruction, up here. Tongue assessment, tongue posture. We do take a CBCT and evaluate adenoids, tonsils, the nasal passage. Dental classes can affect so much. A class 3 jaw means the upper jaw is not growing properly. A class 2 jaw means that mandible could be trapped backwards. It's so hard to go into like a small conversation about the things that you look for, because I think I could honestly say that, like, if you give me some kind of issue that a child has, I could probably somehow link it to airway in one way or another, so it's hard to narrow it down, but we assess a lot of things. It's one of the things that I think people don't understand about airway dentistry sometimes, especially with children. What we're trying to do in children is we're trying to change the trajectory of where they're going. We don't want them to end up with TMD later on. We don't want them to be on a CPAP device. And if we can grow them at a young age when they're actively growing, we can prevent these issues. But it takes a team. it's not me, myself, and I'm not, the dentist alone is not the only person that's involved in this. You have to have communication with ENTs. You have to have communication with myofunctional therapists, tongue tie specialists. OT can be involved in it, craniosacral therapists. There's so much that goes into airway when you're doing it right.
Love it. Great
When
information.
you're building your team, because one of the challenges that I've personally had in my own community is just finding the team that also believes in the same philosophy of care that you, number one, they believe a dentist should be involved. That's step one. And then step two, that the things that you are, proposing are somewhat linked to pediatric sleep issues and adult sleep issues, frankly, that can be treated, can be, observed, diagnosed, and then there can be pathways for that. How did you go about building your support system of specialists and other individuals?
One of the issues that I had in the beginning of my journey, I remember when I reached out to ENTs and pediatricians to try to talk to them about this. Did not want to hear it.
Yeah.
Did not want to hear it. I finally found an ENT in Atlanta. Funny enough, I think it was kind of fate that I knew that my son needed some treatment, and I had heard about other airway doctors that said she's pretty good. She didn't return my phone calls, but I went in for consult for my son. And I kind of forced her to talk.
Yeah, exactly.
And what I really did, funny enough, I think the thing that worked is that I sat down and I asked her questions. It wasn't me telling her what to do. It was more, tell me how you do this. Tell me what this means to you. If I see this in a CT scan, should I refer to you? If I see adenoids and tonsils at this point, I don't want to waste your time. Should I refer that? I want to send as many kids as I can to you that need it. I think opening up the conversation with doctors that are a little bit more reserved on it, it's letting them lead the conversation. You ask them questions and then you kind of dip yourself into there and say, well, I wonder, now I have an ENT that will literally tell my patients, like if they have a removable device that they're wearing, they're like, are you wearing your appliance that Dr. Johnson gave you? But that took 10 years to find somebody. Myofunctional therapist is a hard one because there's not a lot.
Mm-hmm.
There's a lot that you can do online, but I think you lose some of the care for the patient. But sometimes there's
just not. Yeah.
There's nobody there. Myofunctional therapists are becoming easier to find. OT, PT, really, honestly, it was researching online, getting recommendations from other doctors, and trial and error. A lot of trial and error.
How is your son doing now?
He's doing great. He's doing great. He's doing wonderful. Funny enough, when he was little, I tried to put him in one type of appliance. Being in a split family, daddy didn't make him wear it. I did. So we now have him in a fixed expander, but he's doing great. I mean, good. All of his issues have subsided. He's a great kid. It's funny because when all of this happened in the beginning, I had 5 miscarriages before that. And I was like, why is this happening to me? Like, you finally give me the child. Why does he have all these issues? And I look back now and I'm like, God, thank you. Because I not only changed my child's life, but this child helped me change tons of other children's lives.
Sarah, did you see the like a growth spurt once you got him into that expander and things started to open up and all of a sudden there was sleep again? Yep. Did you notice that growth spurt that we see so often after a child has an airway opened up or the nasopharyngeal volume, all of a sudden gets better and they can breathe through their nose again. And so many cases we see that children will go through this growth spurt because they can actually produce growth hormone because they're sleeping.
Yep.
Did you see that?
Oh yeah.
Yeah.
100%. Yeah. What's fascinating? My dad I have a great relationship with my dad now. Took a while. He's in TMD, but one of the things that he loves.
Me too, but this is a whole other show, Sarah.
Yeah.
Yeah.
But he was talking about the sphenoid bone, and that the pituitary and all that kind of stuff is all linked in there. And if everything's locked and not moving properly, it can't function right. And it blew my mind when he told me that. Dad is brilliant. He might be the best coach, but brilliant. But then being able to it's wild to watch kids change in front of your eyes when you start this treatment. It really is. Luke, my son, did it. I watch it happen in my chair every day. It's the coolest thing. It really is.
Are you doing like Frenum releases for the tongue ties?
I am not. Funny enough, I signed up for Dr. Zaghi's course in 2020.
He's great.
I know.
He is
Yeah.
phenomenal, right? But then COVID happened. And in the meantime, I think I dedicated myself during that time to learning all the different appliances and kind of finding out which appliance worked best for me. I didn't want to learn how to do a frenectomy on a video while COVID was happening. But during that time, there are 2 other Atlanta providers that are just phenomenal providers that are Zaghi affiliates. And I'm like, I'm going to let them do that because I remember what it was like to get my child to have a tongue tie release. I'm good with the appliances. I'll let them do that stuff.
You know, it's really funny. And I think that's a really good point for our listeners is that, you know, you may think that you know everything about lasers, but man, those tongue ties, they can really freak you out. I don't have a problem with any kind of labial frenectomy, but if you go underneath the tongue, it's so vascular. Please do yourself a favor before you get into this and take a Zaghi course or somebody's course, because like you, I have people in Fort Worth that I know do it and do it well, and that's where the kids are going. Yep. I would send him to Jeff if he was closer, you know, but that's a delicate procedure. Although it doesn't seem that way, it's
no, they are. Your butthole tightens up about as small as it can possibly get.
Goes like this, like really quick.
Yeah.
Holy shit.
They make it look really easy, but really no 2 tongue ties are exactly alike. And knowing where that laser incision needs to be and where you need to go is honestly, it is something that you really should work with somebody side by side before you ever just take it on yourself.
100%.
Yeah, do it on a dead pig first, please.
Yeah.
You know,
all right, I have to know. Because you said you never wanted an iTero, which I understand. I got to know, like, what changed?
So, you know, I thought I was only into this airway stuff, and I just wanted to learn airway and how to just do the Invisalign after. You know, I knew how to do bracket ortho. I wanted something easier. I'm like, okay, fine. I know Invisalign is the best out there. I mean, I do. But I don't want to spend the money, but I'm like, fine, I'm delving into something that I have to learn this stuff. So my iTero rep, who I usually would hide from, I'd duck and be like, don't tell them that I'm here. I finally said, let her come in. We started talking about it. She wanted me to buy the iTero. And I'm like, I'm a new business owner. I'm not spending this money. But I had started taking Molis Coaching in the meantime, who Ryan is like also one of those people that has changed my life immensely. I tell him he became my dad. Like, he was the person that believed in me when nobody else did. Not nobody, because my friend Stephanie did. But like, that being said, surround yourself with people who believe in you and help you dream big. But I remember he had a thing on Invisalign production day, right? And I ended up doing an Invisalign production day thinking like this, I don't know if this is really what I want to do. I know I want to do airway, but why not? So I can learn more cases. 17 cases started in that day. And I tell you, it was all because of the iTero. And then I also saw all of the other things that the iTero can do on educating patients, time lapse, like it really helps a patient understand what is going on in their body. Like, I remember the days when my dad was practicing and all you had was a black and white film that took 15 minutes to develop. And you just had to trust your dentist that there was a crack in a tooth. So people think that the iTero is just for Invisalign. It is so not. It has built my practice phenomenally because I can show patients exactly what has happened to them in 6 months, a year and a half. And I can show them what is going on with their teeth in so much clarity. Like, it's not only increased my Invisalign acceptance, it's increased my general dentistry acceptance. And I don't see it as a tool to just do Invisalign. It's not an impression tool for me. It is an education tool for me.
I think it's really short-sighted for most doctors if they're just buying a scanner for restorative now, because there's too much capability, especially with an iTero for diagnostics and for Invisalign Fast Track and the simulation and all that stuff. Like, if you're spending all that money just to replace your PVS, you still actually can't make the ROI use case. Like
Mhm.
there isn't a return because there's these ongoing costs and all this stuff. So at the end of the day, if all you're looking for is a fancy PBS machine, you're really missing the boat on what technology should be unlocking for you. And it should not just be that you don't have to use goo anymore. Like we're so beyond that point.
Beyond.
So beyond that.
Mhm.
So
But
tell
wouldn't
us
you
how much
also
you.
agree? Go ahead. I'm sorry, Chad.
Never mind, Jeff. No, just carry on.
No, you go ahead.
You guys all
Oh.
should talk to me.
Are
I
you
love
sure?
it.
You sure?
I'm coming
Uh,
to Texas and I'm going to kick your ass.
So, Sarah, with that being said, what do you think Lumina has brought to the table?
Oh,
I
that
love
was my
it.
question.
Huh?
No.
Yes.
The Lumina is so phenomenal. Let me tell you, doing Airway and scanning kids. Oh my gosh, scanning kids. Not that the 5D was good, right? The 5D was good, but kids just didn't like. It still was more difficult catching the palate to do these
Yeah.
appliances.
Absolutely, yeah.
You can scan a kid with this Lumina and catch the whole entire palate within like both arches, 30 seconds. That's it. Like 30 seconds, maybe a minute, and you're done. The scanning is so much better. Everything is just easier, more clarity. Like when patients look at their scans and they look at the pictures that are in there, just the quality is so much better. But for me, it was the scan time on kids. Like that had me hands down. I was like, yes, please. Love it.
Well, and also the day that you needed the palette, that your staff didn't scan the palette. Anybody ask me how I know, right?
Yeah.
Like, oh, you needed the palette. Yeah. Now at the Lumina, I'm like, they'll get it.
Yeah.
Yeah,
It'll
it
accidentally
automatically
happen.
almost.
Yes.
Yeah. It might look like it has cancer if you don't like just put that camera on it, but it'll get the palate.
Yeah. But at least I can make an appliance on it. I don't have to call the
Yeah.
patient and be like, yeah, we kind of have to do that again.
Yeah.
Yeah.
So, Sarah, I don't know if you lived this or not, if you were doing much in the way of impressioning.
He's a lot younger than you, Jeff. So I mean, probably.
No. What I was going to say is before that rude old man in the upper right-hand corner started speaking, what I was going to say was that how easy it has become to treat children because you didn't have to do an impression anymore.
Oh.
So it has enabled us to get into arch expansion at a younger age because they think the camera is cool,
Yep.
right? Come at them with a bunch of goop. I don't care how fast it is. I don't care how quick it sets. I don't care how good it tastes or how much it tastes like cherries or strawberries. I'm going to tell you that was a crying episode for a lot of children, and it kept us from being able to expand arches sometimes at an earlier age. And then especially once we got Lumina, the ability to capture the palate, capture everything we needed, and be able to do arch expansion and have the kid invested now because what they saw on camera was so cool. I was curious whether you had that experience or not, but you probably didn't have to deal with impression as much as me.
But remember, my dad was a dentist, so
Okay.
I was taking the impression. I was his assistant. I was 14 years old, so I also remember that I'm 40. I'm not that young, you guys. I'm 42 years old. I'm almost 43, so I'm not a baby. Okay, and I have this story in dental school where I personally, they were doing the what is it? Like, what do you call them?
Talk to me when you get your damn AARP card, okay?
Alginate? Alginate? Is that the word you're looking for, Sarah? Alginate?
Yeah. No, the practicals in dental school. I try to forget those days, but we were doing the impression practical, and I had chosen like the top student in the class because I knew she would be doing my injections too. So I'm deathly afraid of needles. So I'm like, Becky, will you be my partner? She's like, yeah. She failed because of me because I'm back there going, like I have the. I felt so bad. She had to retake it. And I'm telling you, she was top of her class, number one. Maybe no, there was a tie for number one. I think there's 3 of them, but like she went into OS. She's this phenomenal oral surgeon now, and I made her fail. Like I made her fail for practical. Like it's also not just about kids; it's about adults too. Like nobody likes those things, you know.
Yeah.
But with kids especially, I cannot tell you how many times I've watched a child vomit, because my dad would take impressions on kids for appliances too. And I can't tell you how much vomit I've seen from children. And I actually, when I first started this journey and I didn't have the iTero, I had a child vomit in the chair. Yeah. Mm-hmm.
Yeah.
Been there.
Been there.
Been there.
Yeah. Actually, I had one last week from
Awesome.
radiographs. From X-rays. Yeah. But maybe as I was just reading this article about, it came out in JADA actually, but how like most Americans are afraid of the dentist. It's a statistically significant number. I'm like, maybe, just maybe, the iTero is going to be contributory to not being afraid anymore. If you think about kids today, and they're like kids today that come in, they don't really have to take gooey impressions anymore.
Mm-hmm.
We slap on a ton of topical before we get them numb. I put the ice light in so they can just kind of chill and watch cartoons while I'm working away. Half the time I don't even have an assistant. Like I'm just cranking it. So I think like there is a horizon where maybe folks could go to the dentist as adults in the future and their childhood will have been so not traumatic with the dentist. Maybe we can start changing the narrative a little bit, and our future colleagues won't have to hear it. You know, I hate you, right? I mean, no offense. I'm not you person.
I'd rather go to the gynecologist than.
Yeah, I mean, I just hate being here.
Most of the people that say that to me have that deep voice.
Yeah. I hate it here.
You know, I'd rather go to the gynecologist, right?
Well, I'm not playing that today, so. Yeah. Anyway, maybe we'll change the narrative. I don't know. Is that too hopeful?
I love it.
Not too hopeful. I think it's, I think it's a different generation too. I really do, of us dentists. I also think that dentistry became so competitive to get into. I think dental schools started realizing we've got to find the people that are passionate, and passionate and compassionate.
Mm-hmm.
So I feel like it's been a different breed coming out for a while now of dentists, rather than my dad, who graduated from Emory and had his he was like telling me how his denture was stomped on and you suck. Like they trained dentists a totally different way in my dad's generation than they do now too. So
for sure. I had a patient the other day who had an occlusal guard. It was probably 20 years old, which is a little gross, but it was time. It was time to make a new one. And I said, okay, well, we can do that. Let me get you finances, blah, blah, blah. And then we'll just do a scan. And she was like, wait, what? And I said, oh, we'll just do a video impression. Like, we don't really take gooey impressions anymore, but it had been 20 years, right? And you could just see her whole body fall, because that's probably why she hadn't gotten one in 20 years, was she was dreading an impression. Mm-hmm. And I said, oh no, we don't have to do that anymore. Like that's old stuff. We moved on. And she was like, this is the best news ever. So I could have charged her $1 million. She would have signed. She was like, yes, okay, let's go. I'm in. New guard today. Anyway.
Well, guys, we are down to like 4 minutes. So I'm going to ask. Yeah, I'm going to ask a question. And I want to ask you this because, Sarah, there are so many people that hear talks like this and maybe have someone in their family that they are touched by this kind of message. I mean, it never fails when you're talking about it that someone says, you know what, some of that stuff sounds like my son, my daughter, my grandchild, my nephew. There's always somebody that is involved with this. And so many dentists will say, like you did, what do I do next? So I'm asking you that question. What does someone do next if they feel like this is something that they want to learn more about?
Well, first and foremost, I'll say that I got my education from all over, and all of the people that teach this stuff, they're phenomenal. They're passionate. I couldn't do it without them.
Wait, you were never in my course.
I was never in your course. No, I was never in your
Let that marinate. Just let it marinate for a moment.
Nicely done.
All of them but Jeff are phenomenal. Yeah. And they're in it for the right reason.
Nicely done, JV. Okay.
But I will say it's funny because I am so passionate about this, and I've learned, speaking for a line, I love teaching. Like I truly love teaching. And I remember thinking to myself, when I started getting to where I am now, because I didn't dream big, and now that I'm accomplishing things that I never thought that I would, I'm like, dream bigger, dream bigger. How can you reach more kids? And I realized I want to teach this stuff. Like, this is what I want to do. And so what I did, my friend Stephanie, who encouraged me to buy my practice, is the one who encouraged me to start this course. And her and I are working together for our first airway course in October here in Atlanta. And it's an intro. Like, it's not for the doctors that are high up, that you've got all that education and that you're going deep into understanding tons of things. And like, you've already jumped down the rabbit hole.
That's a word.
Dove
in Texas.
Dove.
This is more for those doctors that have like, oh, I've heard of it, but I really don't know where to start. And so figuring out case selection, what cases to touch, what cases not to touch, different appliances. Like, here are the different appliances that you can choose from, including the Invisalign palatal expander, rapid palatal expander, Invisalign, like, all of these things in your options, and breaking it down to make it easy to hop back into your practice on Monday and start at least a case and start getting comfortable. It got me excited, because every time I would speak, all the people that have never heard of it before were like, well, where do I start? And I'd always be like, well, you could do this or this or this or this or this, but you're going to get this from this and this from this and this. So I love creating just a really basic intro course to understanding it, different appliances. And then I can direct those doctors to be like, hey, this girl, Tracy Wynn, she's really deep into the MARPE and this stuff. And if you want to learn in the MARPE, Dr. Ilya, Dr. Ting, I love that I can.
Dr. Horowitz.
No, I am not an instructor on MARPE for sure, and that is something that even I am still learn. I still have not done my own first MARPE. I've done a lot of expansion with osteoperforation, but I still have not done a MARPE. I've either referred for surgery or referred that procedure. So we are all learning, and there's always I love that you're doing this intro and then there to offer, where people can go to keep on learning, because we are all continuously learning.
Yeah. And I want to support other airway docs that are teaching out there, because we are a community, and Lord knows 10 years ago, we were not where we are now. And I just want to promote anybody that is doing this for children or adults. Like, you are changing the world when you're doing this. The results you see from patients that are out of pain for TMD, that can sleep better, their kids change, they turn into new human beings. Like, who wouldn't want to make sure that every person that provides that education out there is lifted up, So yeah, I'll be holding the course in Atlanta, October 3rd and 4th. And I believe that Dinks is going to be we're offering $1,000 off for the course.
That's huge.
Sign up. Huh? It is.
That's huge.
It's huge. Again, I just want it out there.
Yeah, we're going to post that tomorrow. So for everybody listening, that's October 3rd and 4th, right?
October 3rd and 4th.
Yeah. So for our podcast folks who won't hear this show for another 7-ish days or so, October 3rd and 4th, we'll have the QR code on YouTube, and we'll also have it in our private Facebook group as well.
Awesome.
Well, thank you for what you are doing in being a spokesperson for Airway, and more importantly, early intervention in preventing these kids from becoming adults that, are riddled with an airway disorder because nobody took the time or nobody spotted the problem in the first place or didn't know.
Yeah, didn't know.
Yeah. Great.
Appreciate
Chad,
it.
you want to close us out?
Chatty?
I would love to. Can I talk again?
Nope.
Okay.
This is your one time. Don't screw it up.
It's a silent close.
Yeah.
I actually took notes tonight, but there were a couple of things that hit my mind, and so I wanted to bring them up. First I want to say that life is full of aha moments, and the majority of us here, I would say all of us, have probably had an aha moment in dentistry that makes us redirect our focus and maybe pivot a little bit and focus on what matters the most to us in dentistry. I think we know what Dr. Johnson's is. But there were a couple of things that she said that really hit me. And one was, kind of what's your dream? And I think that everybody should find their dream and chase their dream. And then there was a quote that she said that I will just say that we can put ... Sarah Johnson, DMD after this. Surround yourself with people who believe in you and let you dream big. And then I will say after that, go out and be big. So, if you do those things, life is a hell of a lot more fun than just sitting there with a drill in your hand and doing class 2s. So find out what motivates you and dream big, do big, be big, and just have a lot of fun while you're doing it, because it makes dentistry a hell of a lot more fun than you could ever imagine. So with that, folks, that's the show tonight. Please be on the lookout for the QR code and the discount on the course October 3rd and 4th in Atlanta, October 3rd and 4th, 2025. So within the next 3 weeks. So other than that, go out, have a great night, do big things, do great things, and we'll see you next week.
And thank you, iTero.
Thank you very much, Align.
Yes, thank you.
Thank you.
Okay. And that wraps up another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.